Then in my second year, I had this course on bioethics, which was bioethics, biosafety, and IPR, intellectual property rights. And that was something that really intrigued me. And I was really interested in knowing more about it. I used to ask my professors a lot of questions. But again, that course, since it was only a semester long, I could only know little bit about ethics, like its I would say basic history of ethics and how it's applied, like which are organization committees that ethics committees that use. So I wanted to get a bit of hands-on experience, and that's when I started applying for internships. So then that's when I used to give, I would say, cold email people and be like, I'm interested in ethics. Will it be possible? So then in the end, I got a response in National Institute of Research in Reproductive Health, and they had a really small ethics committee. So it was a really small office that only 3 of us used to work, and I was their first ethics trainee.
This is the Public Health Millennial Career Stories podcast, where you'll hear about diverse career stories, career strategies, get tips, and learn from others to help you in your public health career journey. If you want to learn about public health careers, or just hear public health stories, stay tuned because you won't want to miss this. Welcome to the Public Health Millennial Career Stories podcast, episode number 110. Hi everyone, I'm Mario. Thank you all so much for joining me. Be sure to follow me on Instagram at the PH Millennial. Be sure to subscribe to this podcast if you have not as yet. Leave a 5-star review. Let me know what you think about the show. Greatly appreciate it. I enjoyed today's episode a lot. This is an international global perspective that we got. I think the first person that I've had with a bioethicist background, the biotechnology background, and moving from India to Canada to go to school and then really getting herself involved in a lot of things, as well as graduating pretty recently. So I think all of those great perspectives are going to be helpful for you in your journey. And she drops a lot of great information that I think a lot of people are going to find useful. There's definitely a tidbit in there about advice to new graduates that are people that are graduating during the pandemic and who are going to be graduating soon. So be sure to tune in and listen to that. But be sure to follow her, connect. She has great advice, and especially around using social media proactively as a passive, active person, which she explains a little bit more on the episode. So enjoy. Today, we have a health science consultant, educator, and ethicist. She got a Bachelor of Technology in Medical Biotechnology at Padmashree Dr D, Patil Vidyapeeth, India. Then got her Master's of Health Sciences in Bioethics with a focus on bioethics and medical ethics. She currently works as a consultant at Amaris Consulting and is also a STEM instructor and GEC instructor at Engineering Outreach Office at the University of Toronto. We have Srushhti Trivedi, MHSc BTech. Welcome to the show.
Thank you, Amari.
And I got your name correct, right?
Yes, you did.
Awesome. I'm really happy there. Well, I'm glad that we can connect. So just tell me, how are you doing? How you been coping during the pandemic?
Pandemic, I have been coping okay. I'm trying to get my life together now since everything is open, trying to get more sun since it's pretty warm in Toronto here. And trying to be more outdoors as I can and still wearing my mask and keeping safe distance.
Yeah, fair enough. Especially now with cases starting to seemingly incline, while people are also testing more at home and not reporting it to officials, so not really knowing where the COVID spikes are. So that definitely makes sense. And I love Toronto as a city as well. Beautiful city. Yeah. So tell me, how do you identify, and then tell us a little bit about your personal background?
Yes, so I identify as a female and my pronouns are she and her. And my background, so ethnically and I would say nationally, I'm Indian. I was born and brought up in India, and I spent 22 years of my life in India, growing up in India. And then I came to Toronto or in Canada to pursue my master's degree in 2019. And I have been here ever since.
Okay. Well, I look forward to hearing more about doing your undergrad in India and then that transition and the decision to move to Canada, which I'm guessing was a pretty big decision at that point in time. So I'm looking forward to that. Awesome. So before we get more into your collegiate career and things like that, what does public health mean to you?
I would say public health. Ever since I know what public health means, I would only associate it one word, that's community. Be it local or global, I would say public health really means of my community, people who are around me, again, globally or locally. So this is something that, yeah, really resonates with me.
Yeah, absolutely. A fundamental part of public health is
Yeah.
community. So absolutely agree with that. Okay, so you got your Bachelor's of Technology in Medical Biotechnology at Padmashree Dr D, Patil Vidyapeeth, India. So tell me more
Yes.
about the thought process of going into school for that degree.
Yeah, so I would say so initially I wanted to go to med school, and in grade 12, I was preparing to go to med school. So how it works in India is when you're in grade 12, after you're done, you appear for like an entrance, like an MCAT that we have here in US, Canada. So you appear and then you go straight away to med school. It's not like you need to do a bachelor's and then go, which is how it works here. So I was preparing for that, but because again, there are not a lot of government public funded med schools out there, and going to a private med school was really expensive. I thought I always had like a biotech degree as a backup option. And then again, when I was trying to narrow my biotech like bachelor's backup option, I came across this degree, and this was really close to like going to med school, because I had courses of human anatomy, human physiology, genetics, cancer biology, immunology, and I would get this degree done in like 4 years or so, instead of spending like 5 to 6 years at med school and then doing my residency. So I would say that was my thought process, because I always liked biology as a subject in school and high school, and then I wanted to know more about it. So I would say this was the best option, going into this kind of program back. Yeah.
Okay, and just so I can better understand the system here, because I know in US and Canadian undergrad programs, you're allowed to like switch your degrees a lot and change your bachelor's. Is that the same in India?
No, I would say, so we don't have options to select courses. So we have like a set of courses or subjects that are there for this program that's available online. So before getting in, you can get like a list of courses that will be there from first year to fourth year, since my was a 4-year program. And then again, it goes from basic courses to more complex courses as you go. So yeah, it's not easy to switch, but if you're in engineering, and if you're doing, say, information technology, or if you're doing mechanical engineering, then moving across the engineering spectrum is a bit easy, but not in something like a biotech degree, I would say.
Okay, that makes sense. Thank you for that clarification.
Yeah.
So you made the decision to do the medical biotechnology coming out of like high school, grade 12, as you said, going into college. Okay, awesome. Yeah. Thank you for giving that background there. Okay, during your time in undergrad, you were a summer trainee at the National Institute of Research in Reproductive Health. So tell me more about that experience.
Yeah, so I would just give you a bit of background on how I ended up there. So initially, when I started my undergrad in my first year and being at a biotech degree, it was very academic and research focused. And when I say research, I mean wet lab, that you go to labs and you do experiments. And I was really pumped in, and I thought that I was really interested in doing research. But spending first 2 years of my undergrad, I came to a realization that this is not something that I enjoy. I don't enjoy spending 5 hours of my day in a lab. In the end, if my experiment fails, and that leads to a lot of frustration. So then in my second year, I had this course on bioethics, which was bioethics, biosafety, and IPR, intellectual property rights. And that was something that really intrigued me. And I was really interested in knowing more about it. I used to ask my professors a lot of questions. But again, that course, since it was only a semester long, I could only know little bit about ethics, like it's I would say basic history of ethics and how it's applied, like which are organization committees, that ethics committees that you use. So I wanted to get a bit of hands-on experience, and that's when I started applying for internships. So then that's when I used to give, I would say, cold email people and be like, I'm interested in ethics. Will it be possible? So then in the end, I got a response in National Institute of Research in Reproductive Health, and they had a really small ethics committee. So it was a really small office that only 3 of us used to work, and I was their first ethics trainee per se. So we had one of the public health scientist who was like my boss, and then we had 2 other supporting, I would say, lab members or like members who used to support a lot of administrative tasks in that ethics committee. So in that experience, I got to know more about the basic process of how ethics committee works. So starting from how SOPs are made and how ethics standard guidelines are implemented. So in India, again, we have something called as Indian Council of Medical Research. So ICMR has a lot of ethical guidelines. So again, I went through that, and also there are then World Health Organization ethics guidelines and even UNESCO ethics guidelines. And then with 2 months of my experience, summer training experience there, I got to attend 2 ethics committee meeting. So in our ethics committee meeting, we had people, or we had doctors and we had experts from different spectrums of life. We had community members, and they used to discuss all the experiments or all the research projects that involved humans or involved even in interviewing humans or even taking their blood samples or bodily tissues. So that was discussed, and there were a lot of ethical issues that came into, and I would say it was my first experience in seeing those ethical issues by being there in that with a bunch of experts, with a bunch of gynecologists. So I would say that was a really good experience, and that was something that made my decision of pursuing my graduate course even more concrete.
Yeah. That sounds like a perfect, great decision. Because as you said, it made you go into the bioethics. But what I really liked that you said there was that you started off doing this degree. You thought you'd like research. You found out you didn't like research that much, and then you had like an introductory course to bioethics, and you're like, oh, this is fascinating. But unfortunately, you can't get any more like of these classes through this degree. And then you started cold emailing people, which I think is something that a lot of people are scared to do. But as you look at you became the first student trainee, you're able to get that experience and also solidify that this is something I want to do for my master's degree. So that is awesome. So I appreciate you sharing that.
And I would just like to share that, getting an ethics internship in like India I was first off, not a lot of people who do that. So I know a lot of people who are in this kind of work, but they don't have offer internships. So when I just went in and said, oh, I want to be a summer trainee in your ethics department, my boss or that public health scientist under whom I was working, she was like, are you sure? Like, do you really want to do this? And I was like, yeah.
That's awesome. Well, shout out to you for doing that. That's truly awesome. And then you're also a project trainee at Tata Memorial Hospital. So tell me a little bit more about that experience.
Yeah, so again, that experience was so in my program of medical biotechnology in my last semester, it was a dissertation based program. So I had to do a dissertation. So then again, I chose to do this dissertation at Tata Memorial Hospital. So again, it's a cancer research hospital, one of the biggest cancer research hospitals that we have in India. And I did this internship in a hematopathology lab because it was a requirement that it had to be wet lab and dry lab. Wet lab, and the reason I chose this internship or this dissertation place was because I get to work with human samples. So my project, the basic gist of my project was we used to get blood samples of cancer patients in the hospital. We used to analyze in a hemo analyzer, and then I used to interpret the findings based on what we got, and then we are trying to measure a parameter. So I did like a really small part in a big research project, but I would say that was something that I did not do, or I did not have a chance to do it in my undergrad university, because we only did laboratory based experiment, but we never worked with the human blood or human fluids.
Okay, that also seems like a very pivotal experience as well.
Yeah.
So was it because you went on and got your Masters of Health Sciences in Bioethics, which we'll talk about in a little bit. So was you taking that bioethics class and then becoming the summer trainee did that really solidify and say, okay, yes, this is the master's degree that I wanted to do, or was there anything else that came into that thought process?
I would say, of course, my introductory course and my summer training internship did make me want to do this bioethics course. But yeah, I was also doing, I also wanted to do something that was research based, but not, I would say that's not laboratory based. So
Okay.
that's why when I was applying, I also applied to schools with basic biomedical science courses abroad that would allow me to choose courses that were more epi based and that were more stats based, and also Master of Public Health. But again, my first preference was obviously getting into bioethics. It was a very niche field. And again, explaining it to my parents what ethics is, and them trusting me with this program was something that I'm really happy about, that even when they could not understand, because even ethics here in US and Canada is so niche. So again, making my parents understand back in India what ethics is was a learning curve, but yeah, I made through.
Yeah, well, that goes to show your experience there, negotiating with your parents to let them know, like, hey, this is something I want to do, is valuable, because as we know, it's really hard with a lot of parents to take them away from like that traditional route of, okay, I'm going to be like a physician, or I'm going to be a lawyer or engineer, and do something else that isn't like the traditional type of job. So I'm glad that they were able to do that, and I'm glad that you were able to form your path as well. Were there any other undergrad takeaways that you wanted to share with us?
I would say in undergrad, the other takeaways that I had was being an all-rounder. That my interest in doing something even before bioethics came into picture was doing something at an international level. So there was a point when I was thinking of doing a course on biodiplomacy, because I used to attend something called as Model United Nations. So it's a mock United Nations, and I really found it cool just to go there and, like, you can be someone who's an expert. So I was a part of this committee on United Nations Organization of Drug and Crime, and again, trying to share values and share thought process was something that I really like. So I always knew that I wanted to share my views, share my opinions at an international level and represent myself. So again, that's something that, doing something out of the box is, you won't see a lot of people doing it. And that's why I also had a lot of self-doubt going into that ethics training program, because I was not sure. A lot of people like, oh, are you sure of doing this? But I think, yeah, you need to be resilient. Just try and see if you like it or not. And then again, coming in with big learning, you will either be sure of it or you won't. So yeah.
yeah, definitely. You definitely take chances on yourself and on experiences. Yep, absolutely. And I think I missed out in the bio that your Master's of Health Sciences and Bioethics was at the University of Toronto. Just I don't think I said that. So just so everyone knows that. So you went on and got your Master's of Health Sciences and Bioethics with a concentration or focus in bioethics and medical ethics. So tell me firstly about that thought process for, well, are there other bioethics programs that, like, master level programs in India, or any other programs that you were thinking about, or what was that thought process of going to University of Toronto? And I know you also said that you thought about the MPH, but you thought the masters with the bioethics was more aligned with what you wanted to do.
Yes. Yeah. So again, when I was applying to schools in my third year, by the end of my third year, I did look at a lot of bioethics programs, because a lot of schools in the US also offers it. But my, I would say, criteria was going to school that was accredited with World Health Organization. So again, there was not a lot of schools that did that. So I applied to University of Toronto in Canada. Then I applied in University of Columbia, Columbia University in New York, because that, and even in John Hopkins. And then again, if this didn't work out, because I was aiming for fall 2019, I also had Australia, so University of Melbourne, I think, or no, Monash University in Australia, that starts in January of 2020. That was also something that I was intending to apply. So again, all universities that were accredited to World Health Organization and that offered this kind of program was my list of universities.
Yeah, that makes sense. And it goes to highlight like what you were just saying before, that you wanted to have this international focus. So why not get a program that is accredited
Yeah,
by the World Health Organization,
yeah,
that is an international organization, a global organization? So
yeah,
that makes a lot of sense. And shout out to you for like thinking about that and then approaching it that way.
yeah.
So tell me a little bit about that. I guess the transition to Toronto from India, that Toronto is a lot cooler than India is,
Yeah.
and there are a lot of differences there. And I know we were chatting a little bit before that you were
Mhm,
from you're from Mumbai, and I said that I visited there a few years
mhm.
ago. So tell me a little bit about that transition.
Yeah, coming from 100% humidity to minus 100% humidity, I think. Yeah, so I came here straight out of my undergrad. So I completed my undergrad in 2019, and then I was in school again that fall in September 2019. So again, I did not plan on coming to Canada or University of Toronto because I got the admits very late into the whole process of applying to university. Like I got into a university for bachelor's in masters in biomedical sciences in Netherlands, and me and my parents were almost really sure that I was going to Netherlands. We had paid the tuition fees. We had almost booked the student residence there, and then bam, in June, I would say 6th or 9th, at 10 p.m. in India time, I got this email just saying congratulations, and I couldn't even read that 6-page PDF. All I could just read was congratulations. uh, so again, my whole shifted. My thought process for last 2 months was I'm going to Netherlands, and now it was just coming halfway around the world or across the world to Toronto. But yeah, and then again, me and my father, we made like an Excel sheet and pros and cons of going to both the places. That Canada is an English speaking country versus Netherlands. You would need to require Dutch at some level if you go outside to university to work. And again, the program, my program was affiliated with Dalai Lana School of Public Health at University of Toronto, and that school itself had like top 10 public health rankings in the world. So again, we just weighed the pros and cons and then decided to go to University of Toronto. And again, coming here, I would say was a bit intimidating because I was doing it all by myself and I was 22. So I remember ordering a coffee, and here people take black coffee. So I didn't, and usually in India, we don't take black coffee. We usually add milk and coffee, and that's coffee for you. So I ordered a coffee and I got black coffee, and I was like, oh, okay, is this what it is? Is this what is? Yeah. But yeah, it took me, I would say, some time, like 6 months to just settle in and figure out how my life here would be, because even the education system is different. And even I really took, I would say, a big leap from biotech to health science, knowing not, and even the healthcare background or how public health works is exactly opposite. Coming here, we have universal healthcare, and there it's usually the payer system that we have in the US. So I would say it was a bit again of a learning curve, and I was the only international student in my program out of 12 to 15 students that I had. So again, knowing the becoming more relatable uh, took me a while. Uh, but yeah, I think it wasn't a smooth road, but yeah, eventually down the lane things was settled, and yeah, then I went through this program.
Okay, that's awesome, and like kudos to you for taking that big step at 22 and being able to deal with the culture shock and not get your coffee with milk and and all of that good stuff.
Yeah,
But
no, I think even coffee in US and Canada is different. It's half and half in US, and here we say double double. So
okay,
it's
interesting,
different. Yeah.
interesting. Okay, well, I'm glad that you're able to settle in, and I know definitely in a small cohort like that, it could
Mhm.
be tough to make those connections, but I'm glad that
Yeah.
you'll be able to push through. Okay,
Mhm.
so you had a position while you were getting your Masters of Health Science in Bioethics as an early learner assistant at Kumon, Canada. So tell me a little bit more about that experience.
Yeah, so I think the reason so that was like my part-time position that I was doing just to pay my bills and just to like cover my cost of living, because tuition fee for international student is 3 times more. And yeah, so that's why I really wanted to do something apart from school as well. So the reason I started this was to build more confidence, because when I came here, I felt really underconfident, in a way that you see yourself not fitting in because you're not from here. And it took me a while just to acknowledge that, yeah, it's okay to be different, and to build that confidence. So I would say this position was, I would just an instructor helping students in their math and English homework, basically from elementary school to middle school. So again, this would help me build my confidence, and also make me make my because, not again, coming from an English speaking background, uh, and being in a native English speaking country, you feel underconfident. So again, trying to improve my communication skills was important, because I had to, if I had to share my views and opinions, I had to have that clarity of speech. So I would say this experience really helped me, because I was able to interact with students, and if I'm able to break down such complex stuff at a very basic level, then I can explain even again big concepts at a really lower level to my class, or I'll be able to share my thoughts and opinions more clearly. So again, this was the thought process that I went into. But then COVID happened, and then this, yeah, I stopped working for this position.
Okay, well, that it sounds like you're very like intentional in both the sense that, okay, I need this job to pay for stuff that I'm doing here, as
Yeah.
well as it's going to help me build confidence, be able to speak more natively English, and just understand maybe like just cultural norms that people do, as well as getting that education aspect of being able to teach better and break down concepts into small, easy bits and pieces, which is awesome as well. And I guess going back to you saying that you felt like a stranger and things when you moved into the program, here I have that you were the university representative at the Canadian Bioethics Society. So tell me how you get into that?
Yeah, so I would say this all started once I was more comfortable here. So again, 6 months down the lane, when I completed my first semester.
Can I pause there actually, because I was going to ask what are the things that you did to like feel more comfortable coming into like this huge new environment?
Yeah, so I would say one of the things was, again, first of all, identifying why I was feeling unconfident, and identifying, because I could not stop feeling overwhelmed each time that I was in class and there was something that was going on and I was able to share my opinions. I would say number one was, first of all, doing something outside work. So again, this Kumon job really helped me calm down, and again identify that, okay, this is the issue, so this is how I'm going to work on it. And then other than that, my professors, they have been really great. They have been able to guide me to resources that I can take. So again, with all my assignments and even structuring, and even I would say, they also gave me the freedom of even giving them an outline of an assignment and getting it approved. So again, they really treated me like their own daughter, and they were like, oh, we are going to walk you through this, because we know that this is all the things are new for you. So again, they were very accommodating. And again, another thing is, even when you're scared, don't be scared to ask for help for your professors, because they are there for you. They are there to help you out, and they are there to walk you through this whole program. So that's why I would say them being able to guide me to, even if when they were not being able to help, they guided me to different resources we had at the university. And again, them helping me academically, even at the assignments, was something that made my transition pretty smooth.
Okay, well, I appreciate that, and thank you for letting me interrupt you for a while there.
No problem.
But that's also awesome that you came in and you're just like very self-aware of that, and well as like being introspective on, okay, what is the reason that I am feeling this way, and how can I address that? Because a lot of people don't even get to that introspective part of looking at things, and even taking like the actions to say, okay, this is making me uncomfortable. This is what is in my head that's making me uncomfortable. How can I make that better? And I'm also guessing that the professors didn't just like randomly help you. I'm guessing that you were very proactive just from this conversation that we've been having now, and that you went up to them and you asked for a lot of that support, and you made it clear that you were there and you were guided and you wanted the resources and additional help, which I think is also something that was very beneficial to you moving to Canada and taking on these different roles. Okay, well, sorry about interrupting you. So university representative at Canadian Bioethics Society.
Yeah, so again, once I was more comfortable with my experience at University of Toronto, again, I would like to thank all my professors for that. So then I would say, because I have such an all-rounder personality that I don't want to only do academia, or I don't want to only do academics, but I always want to do something outside academics. So again, this was something that one of my professor mentioned in the class, because we have this Canadian Bioethics Society has conferences every year. So again, once I came to know, I just randomly went onto their website and they had university representatives. So again, I don't remember, but we have like a coordinator and then representative. So then I got to know that coordinator is from University of Toronto and she is doing her PhD in bioethics. So that's when I reached out to her on email, and then I was like, can we have a chat? I'm really interested in knowing more about you and your experiences. And then I met with her in a student lounge that we had, and then I just shared my interest of becoming a part. And then because I always want to know what I am getting myself into, so I just got a brief idea of what it would look like, what does representing the university at this level mean, and then again, once I was really sure, I applied. So they have this whole online process of applying. So I applied, and then we usually have bi-weekly calls, a teleconference calls, because people from all across Canada are able to join, from Calgary, Winnipeg, and even University of Toronto, and so.
Okay, that's awesome. And like, good. Once again, you're probably taking those steps, realizing that there's an alumni here, and it's easy to reach out to people like that, and they're happy to have those conversations.
Yeah.
Hopefully, if you guys had some coffee, there was some milk there as well. Yeah. And we're gonna go through a couple other roles that you had while at your time at University of Toronto, and like, just to point out that you did a lot of things when you came to Canada and did a lot of the schooling. So like, kudos for you to taking on a lot of the different roles that we're gonna continue to speak about for a while as well. Okay, so you worked for Public Health Ontario as a bioethics practicum placement, as well as did your Capstone Project lead there. So tell me a little bit more about that experience.
Yes. So again, my all public health experience comes from working with Public Health Ontario. So again, how it started. So in our first year, we have practicum courses, which is more like getting practical experience in the world out there. And then in our second year, we have a Capstone Project. So while I was figuring out supervisor, people potentially who could be my supervisors, I also reached out to a couple of professors, because bioethics conventionally is ethics applied in a hospital setting. So there are clinical ethics who make decision in a hospital setting. So I also reached out to them, but I lacked clinical experience, and that was something that I knew that could not happen over a period of time, like little time that I had for this program. So then I started working with my professor who was teaching a bioethics, empirical approaches to bioethics course back then. And she had a PhD in genetic engineering. And she was from a genetic engineering background. And then she also went ahead and did my same program, but back in 2009, I think. So when I reached out to her, she was more than happy to take me on board. And back then, again, we were discussing that I could come attend meetings in person, and I could potentially work on an AI-based project, because I did not want to just throw my biotech background into the garbage and go into a completely different field. So I wanted to keep that tech side as well. So we wanted to go, we had this potential idea to do something with AI in healthcare, or using data in AI in healthcare. But that really went down the drain when COVID happened. And then my entire project shifted to a COVID project. And then I was working. So practicum was more about attending meetings, different meetings that happened at Public Health Ontario level. So again, there were people from Ontario Health data platform who were there. who wanted to get their projects approved, and then also attending ethics meeting and what kinds of projects that come to Public Health Ontario and other different kinds of meetings. So we also had, I would say, roundtable conferences that happened back because of COVID. And there was also another, I cannot remember at the top of my head, but again, a similar kind of meetings where experts from different, even public health, they came in and they were discussing ethical issues that started because of COVID, and how to deal with it. And then I also did my capstone project. So capstone project was a really small project that I did with my supervisor, and that was majorly on analyzing informed consent issues for the contact tracing process in minors. So back when anyone used to test positive, we had this whole contact tracing process in the public health forum, where you could get a call, and the caller would then ask everyone to get on the call. So what is the most optimal way to get consent, and especially for minors? So again, we did like a bit of snowballing process. I got to speak with experts, not a lot of experts, but definitely public health experts who were training or developing trainings for these contact tracers who are calling, and also what are some things that come up at the public hospitals that are there. So again, that was a really interesting project. I went through each and every step of getting a project proposal, applying for ethics committee, getting it approved by ethics, and then doing it by myself. So I would say that, yeah, that was something that really made me happy.
Yeah. It seems like a lot of work, and definitely very fruitful to see it throughout that entire cycle, which is awesome. And just a plug for a book, Carte Blanche: The Erosion of Medical Consent by Harriet A. Washington. I don't know if you've heard that, but it's a book that I recently read, and it goes a lot into the erosion of medical consent in today's day. And there's like, in the beginning of the book, it starts off with COVID-19 as a so it is a very interesting book. So I'll just put it out there for other people if they're interested to check that out. Okay, so I appreciate you sharing that. You are also an executive council member for the Public Health Student Association at the Dalai Lana School of Public Health at the University of Toronto. So tell me, how do you get into that position?
Yeah, so again, I would say doing all of this, a lot of projects, made it more easier when I was doing everything from home, because I could multitask. Otherwise, if I had to commute to school every day, attend classes, and then do it, I'm definitely sure I wouldn't have been able to do it. But yeah, this is executive committee is again, I was more like a liaison between the executive committee that talks to the dean of Dalai Lana versus the other executive members. So again, we were a team of, I would say, 6-7 individuals who would attend these bi-monthly executive meetings, and we would share all the issues that student council had, and we would present it at this executive committee meeting. So that was basically it. And since again, those meetings were on Zoom, so it made it more easier to do it from home.
Okay, awesome. And that's dope that you're getting like that leadership experience, as well as more of the lens on like public health, all the like bioethics and everything falls under public health. But and then you also had a practicum student. You were a practicum student at Access Alliance Multicultural Health and Community Services. So tell me more about that.
Yeah, so again, for this project, even when I was doing so many things, working with Public Health Ontario, I was feeling a bit detached from my work, because I was not doing it for the community or for my people. So since I am an immigrant here, I would say I was really interested in working for those kind of, especially those kinds of population. So again, at Institute of Health Information at Dalai Lana itself, so that we had a quality improvement project. So again, that came up on my LinkedIn one day because I was following so many people. And then I just signed up on a Google form, and then an initial interview process where why would I want to be do this project. And then Access Alliance is a community healthcare providing agency which gives healthcare free of cost to all the members of community. So again, uninsured people, new immigrants, refugees, everyone. So I was really glad to work with them. And again, my supervisor was an immigrant himself back in 2010. So he was able to guide me more through this process. And again, we did a whole client evaluation survey. So they had taken survey from community members on their healthcare services. So they used to call them. So we were trying to now build a model based on those survey responses. What are the things that could be improved? What are the things that are really good and that should go on until next year? So again, I was doing this with other two members from other students from UFT. One of them was doing their master's in health policy and the other one was in med school. So again, it was a great meeting new people kind of experience working in a team versus my public Ontario experience where I was just me and my supervisor, but not a lot of team that I could work with.
Yeah, and also getting the experience of working with people with different sorts of backgrounds from you and collaborating on that, I think is also very, very useful. So that's awesome as well. And shout out to LinkedIn and connecting to people and coming across opportunities, right?
Yeah.
That's awesome. And then you were also a quality improvement project member at the University of Toronto, chapter of Institute for Healthcare Improvement. So tell me about that.
Yeah, so I would say this is exactly like the Access Alliance is a part of Institute of Health Information. So they have this quality improvement project. So they placed us with Access Alliance and then we worked on that project. And then we had a conference where we presented our findings.
Okay, that's awesome. And it's always great when you're able to do work and then get the opportunity to present it as well.
Yeah.
So you also, during your time, you're also an academic preparation mentor, and I have for 1 month here, and I'm guessing that's at the University of Toronto. So tell me how you got into this.
Yeah, so I would say this opportunity came in. So back again when I was in pandemic and I was trying to find different jobs, teaching jobs that I could do while being working from home. So I came across this opportunity at engineering outreach office. And I would say this was one of the best positions that I got because it really complemented my biotech side, my pseudo engineering, I would say, not complete engineering, but biotech, biomedical science background. So again, academic prep was one of the position where you train high school grade 12 students who are going into grade 12 and just give them a bit of university exposure or experience. So it was virtually. But they have a lot of questions on what is the application process, how you can apply, how you can make your resume, and how even if they have done any part-time position, how you can make those skills transferable to university. So I would say this was again academically prepping students who are going into grade 12 and then potentially hoping that they would join University of Toronto, since we were the kind of ambassadors. So again, this was the position. And then I have worked on a multiple different positions with engineering outreach office ever since.
Yeah, okay, that's awesome. And I guess it goes back to that education part of the things that you like to do and pushing for that, as well as like helping the youth find their path and their way, which is awesome. Okay, so you said that you still work at the engineering outreach office, and we'll talk about the two positions that you work there. So you're a STEM instructor as well as a GEC instructor. So firstly, what is a GEC instructor? And then tell me more about both of those roles.
Yes, so GEC means Global Engineering Challenge. But yeah, before that, I would just try to tell you more about my STEM instructor position. So STEM instructor, basically, so there are STEM programs that are offered by Engineering Outreach Office at University of Toronto. So those programs are basically 4-week programs for high school students from grade 9 and 10, and then 11 and 12. So again, they are just 4-week programs where you get an introduction to advanced science courses. So I have been teaching courses, say bio, artificial organs, tissue engineering, even bionics. And even I would say last semester, or like last fall and winter semester, that was ethics in modern medicine and biotechnology. So I was able to integrate ethics into this whole engineering world as well. But these programs are just to give an overview to students who are potentially interested in pursuing biomedical engineering or a biotech kind of background at University of Toronto, and just tell him then that, okay, this is what really exists out there, and these are kind of career opportunities, and these are new fields that are out there for people who don't know. And again, I was able to integrate even ethics into it, because again, I would say with technology comes health equity. So I was able to integrate these kinds of aspect, and I was also able to complement my courses that I learned in my undergrad, and able to educate young students and help them make decisions, or at least guide them.
Yeah, that's hugely important. I think like the exposure is such a huge piece of it. Like, because if you don't have any exposure to anything, then you're hardly likely to choose that decision. To just have an exposure to a vast variety of things and seeing people that are actually doing work in it, and to your point, talking about the experience in university is very, very helpful. And so I appreciate you for doing that work as well.
Yeah, I mean, I had no idea about these kinds of courses existed when I was in high school. So I think the fact that these students know that these kinds of courses exist and enrolling for it is like they're one step ahead.
Yeah, absolutely. And I think we need more type of stuff like this for public health, because I feel
Yes.
like it's not there as yet, especially for high schoolers and things like that. So yeah, that's awesome. Okay, so another question that I had. So these are all the experiences that you did while you were in grad school. How were you able to manage that? And do you think the fact that the kind of like the pandemic happened and a lot of this was virtual, that was helpful for you to be able to do a lot of this work, or was that a non-factor?
I was, again, number one, to begin with, how I was able to manage it. I would say I was able to manage it because pandemic happened and I was able to do a lot of things at once. But I would say if there was no pandemic, the quality of these experience would have been much better. Even if I would not have done all of it, the quantity, it would have been really less in quantity, but the quality of meeting people, going to Public Health Ontario office, I would have gotten a desk, meeting people, experts from infectious diseases, and literally sitting in on a table with those experts in an ethics committee meeting would have been a really great experience. And I would say, again, managing is using calendars. Like I would say, I was really off the wagon of using calendar lately, but now I have started doing it since last month, because it's really difficult to find time and schedule. And another thing, the reason I started doing a lot of things was because I was staying by myself, and it's really easy to get distracted and to get homesick when you're all alone away from your family, when you don't even know when you'll be able to travel because of so many restrictions. So doing these things really kept me busy, and I was able to, I would say, focus my energy onto more productive things rather than just overthinking and being at home. So yeah, this is something that I did.
Yeah. Well, I appreciate you sharing that, and I could
Yeah.
imagine like that difficulty of the like isolation. But I'm happy that you were able to like utilize the time and focus on those productive things and get good experiences. And I also like that you highlight that though you had like a lot of opportunities, because it was virtual for the most part, it was harder to get a lot of depth in those experiences and like build those relationships that you would have gotten with meeting with people in person and just being in proximity with those people, which is I guess both good and bad, but you made the most out of it in an unknowing situation, which is awesome.
Yeah.
Okay, were there any other masters takeaways that you wanted to share with us?
I would say other masters takeaway is, because I want to say it to all the international students who are out there and who are also doing this kind of public health program or even thinking about it, is if you want to, you don't get it if you don't ask for it. because even if you're feeling a lot of things, and that's normal when you change countries, or when you even move from, say, Canada to US, when you go to a different city, all those feelings and emotions are justified, but nobody is able to understand them and help you if you don't say it or you don't ask for it. So I would say, I initially, I was also really shy and I would not ask. But then once I started asking my professors for help, people would just go out of their way to help you. So again, I would say one of the important takeaways is you have to ask for it if you want to get it.
Yeah, I absolutely love that, and I think it is so true, and that's like a huge realization. I feel like just not only professionally but like in life, you're gonna have certain feelings and things, but no one's gonna know how you're feeling, and you have to do your best to communicate what you need, and I think that's important. So I appreciate you sharing that as well. Okay, so you graduated. I believe were you a research study assistant at St. Michael's Hospital after you graduated?
Yes.
Okay, so I'm correct in that. Okay, so you graduated and then you became a research study assistant at St. Michael's Hospital. So tell me a little bit how you come across that job, and then what do you do in it?
Yeah, so again, I just want to like state what I was saying before, that because when I was in my second year and I was looking for jobs, different kinds of fellowship positions, even research positions that I was considering, I was putting myself out there, putting the word out there that, if you know any position, or if you know any research assistant position that are hiring, let me know. So I was just telling all my people, and even in my professional network, just having coffee chats and telling people that, oh, I'm available if you need any kind of resource support. So I got this position. I came across this position through a colleague of mine who I was working with at Access Alliance. So she just randomly sent me a screenshot that, someone is hiring, because she herself worked at St. Michael's. So just email it to her. So I was like, how bad could it be? So I just sent her an email at, I don't know, I think I sent her at midnight. And I didn't even expect that, they would call me or like they would talk to me. And then I would say a week later, they got back to me and they were like, we would really like you to work on this project that we have. So that's when we had like an onboarding meeting. So they were trying to do, so it was a health economics project. So again, going into this, I was a bit skeptical, because doing health science, biotech, and then going into health economics. But I took it as a learning curve, a challenge again, that health economics still has health in it. And I assume that it would really have a small economic part to it. So yes, again, going in, it was a health economics project based on analyzing the cost effectiveness of diabetes. So again, going in, they onboarded us onto this project, and we were just doing I would say we were just reevaluating a project that was done in the past, so validating the results again, because I think they got a, what's that word, they got I wouldn't say rejection, but suggestion from the journal that the results are older, because they were doing a systematic literature review. So they had to do it again just to see if there are new studies out there. So again, they did, I was a part of that whole systematic literature review part. Again, this was my second time doing systematic literature review, something that uh, was still really new. And now I know I do it for a living, I feel. uh, but again, putting myself into doing this new project helped me land the job that I have today. So that's why I would say that opportunity was coming my way. So I just told myself, how bad could it be? It's not a long-term commitment as well. It's just a short contract. So, give it a try. And I've always been up for trying and seeing if I like it or not. So again, I did go through that project, and yeah, now I'm here.
Okay, well, that's awesome. And then, well, firstly, like shout out to like using your network to see if there are positions and getting that screenshot back. But then also important of like saying this is health economics. This is not exactly what I know about, but there's that health part, and I can figure it out. And like diving into that like uncomfortability, that unknown, and from what you're saying,
Yeah.
like thriving through it and getting to better.
Yeah.
One question that I did want to ask was, so going into your master's program, did you have an idea for what you wanted to do afterwards? And did the idea for that change when you were going through your master's program?
Yes, I would say initially, because I really had a very conventional idea of bioethics, I always thought I would be interacting with patients and I would be in ethics committees, because my experience has been being on ethics committees and just attending them, organizing them, doing all the administrative part of it. So I would say my idea was doing that. And then doing throughout the masters, I did not think it, I thought that I really wanted to do that, but I wouldn't be able to do it in a clinical setting because I am not a clinical expert. I do not have a clinical background. I don't have any experience, say, be it nurse or physiotherapist or even a physician or a doctor. So now I really wanted to combine my technology side and ethics side. So I was always trying to find a middle ground on how I could integrate both of this field. And I would say, just to add on the question that you asked before about my master's learning, I would say ethics is a practical field. It's not, I would say, a particular hardcore science-based field. It's an interdisciplinary field. It's an applied science. So I could apply it in different fields. I don't have to be in a clinical setting in order to apply ethics. I could be in an industry. I can be in a pharma industry and still apply my ethics knowledge. And all the research skills that I've picked up from all the experience that we talked about, I could always apply it in different settings. So I would say, yeah, that's been my learning process, that skills are more important rather than a position. So again, when I was applying for jobs, I was applying for research coordinators, for ethics officers position, for ethics assistant, research assistant, yeah, and so on and so forth.
Okay, that's awesome. And I'm glad that you highlighted like skills are more important than that job title, because those skills can fit into many job titles, and we isolate ourselves and box ourselves in many times when we just look at specific job titles as opposed to the skills and skill sets that they're asking for. So that's awesome. Okay, so you are also a advisory committee member at Misinformed. So firstly, what is Misinformed and what's your role as an advisory committee member?
Yes. So again, I would really, so once I completed my research assistantship at St. Michael's Hospital, I always, and I was no, and I also did I completed my practicum at Access Alliance as well. So I knew even when I was working full time, I really wanted to be involved with some sort of NGO or some government initiative that really resonate with what I feel, what I value, and what I really, the causes that I really feel for. So I would say Misinformed, it is an online website. It is an educational platform that gives information on female reproductive health and female health, and it is an evidence-based scientific blogs. And they also have really cool initiatives, like they have COVID vaccine portals in, I would say, more than 10 languages now. So they have different kinds of initiative, but again, they resonate with female health and reproductive health in Canada and globally. So they were recruiting. So it's not really old. They just started in the pandemic, and now they have a proper committee and organization. They are now registered as a non-government organization. So they were, again, I came through this through Twitter. So before I talk more about it, I am a really big social media user, and when I'm looking for job or when I'm looking for anything, I use social media at the fullest. Like I follow all people, and that's how I even came across you, that I was following you on Instagram. So I was following a lot of academia people on Twitter, because Twitter academia is huge. And then I got to know about this position, and again there was this Google form involved. So I filled that Google form and they interviewed me. So it was a two-stage interview process, and they wanted someone to bring diversity into their organization and give a different perspective, because coming from India, having a third world nation perspective, bringing to Canada, and again, being a South Asian woman here, what are different things and different areas we can cater to, especially for females out there. So I am in their advisory committee, and my role is to advise on not only the scientific blog posts that they post, but also the kind of initiatives and projects that they have. So again, they are launching, they have got funding from different sources, and they're all also looking for funding for different projects. So that's why giving them advice on project proposal and grant proposal is, yeah, that's what my role as an advisory committee entails.
Okay, that's awesome. And shout out to them for like wanting a diverse person to be in this position with like a varied perspective, because I think that is important. And that's something that is not always done or not actively seeked out. As well as shout out to you for using social media to its fullest. That's good. That's good to hear that you're using it and still getting like good opportunities, because I think it is underutilized. People use social media for a lot of the wrong reasons, or not wrong reasons, but not the most productive ways. So yeah, shout out to you there. Okay, and you also got a mini MBA, or did a mini MBA course by McMaster University's GMCA. So why do you want to get this, and what are some learnings from this?
Yeah, so I would say GMCA is Graduate Management Consulting Association that we have at all the universities. So we have at University of Toronto, even McMaster. And this was this mini MBA program. So I had time once I was done with all my submission in my second year, just before graduating, but after just waiting for results. There was like a 2-month gap, and I didn't have anything to do. Like I did not have any projects to work on, and knowing me, I wanted to do something. I wanted to make the best out of time that I had. So I enrolled myself into this mini MBA program. Again, it was, I would say, a month-long program that we had, and going into it, I thought MBA is boring and it was not something that would interest me. But I would say, again, going into an MBA program, or like just, it was a mini. So it is 10% of what you learn in an MBA school. But even knowing that and how I could apply it to my industry, apply it even if in public health or even in the pharmaceutical industry, there are a lot of skills that you get, management skills that are always useful. So that was something that was really important. And again, there were people who were from healthcare management consulting background, because a lot of schools have this kind of program of an MBA in healthcare consulting or in healthcare. So that was really cool, and they were able to just give us a bit of snapshot on, what the management corporate world looks like and how it works.
Yeah, that's awesome. And yeah, I'm glad that you were taking on that. And one thing that I always say on this podcast is that they don't teach public health people enough about business and the business side of things. So yeah, I think that is something, as you said, it's very transferable. It's something useful in whatever you get into. It's going to be useful, as well as just saying that I did a mini MBA at McMaster's, which is pretty good as well. So that's awesome. And so you currently work as a consultant at Amaris Consulting. So how do you come across this role, and what do you do in it?
Yes. So again, once I was done with my research assistant at St. Michael's, I had not visited my family, since I came here. So I was on like a 2-month vacation when I was in India. And even there, I was applying for jobs because I really wanted to have a job when I come back. So while I was applying, someone from Amaris, the human resource person, reached out to me, and they were like, would you be interested in something like this? And I didn't get it, because I am not, so I am a consultant in health economics and market access team. So it's a HEMA team. So again, I didn't get a lot of it, so what it meant. But the job profile and the job posting with the responsibilities, it made sense that, I do have a lot of skill set, and then there's an industry part to it. So I was like, okay, what's the harm in seeing what it is? You can always say no later on. So then I went through this 3-week or 4-stage interview process with them, and turns out that this consultant position is more research related than management related, because whenever you hear a consultant, you think, oh, it's management. But again, they told me more about what kind of projects they have and what kind of opportunities and what this role entails. So again, I am a consultant in their HEMA team. So even in the HEMA, I am in the market access team, which goes on, which again divides into EVA, which is evidence review and value communication. So evidence review means that there's a lot of scientific evidence out there. So we review those evidence and then we summarize it in a Word form or in a PowerPoint form and give to our client. So our client are a lot of pharmaceutical companies who outsource their research part to these consulting companies. So again, in places like Canada and UK, where you need your drug to get it approved by public health federal agencies before it's in the market, you need to submit a lot of documents. There's an HTA submission, there's a NICE submission that goes on, and in that there's a systematic review part where you compare your drug with all the existing drugs that are out there. So again, we conduct literature reviews, different kinds of literature reviews, and sometimes we also interview experts who are out there, so key opinion leaders. And then again, we summarize it in a Word document or in a PowerPoint slide deck, and then we give it to our client, and then client can use it for for any kinds of submission that they need.
Okay, that's awesome. And I'm glad that you were able to get 2 months of vacation. I was going to ask, like, have you been back to India since the pandemic? And it sounds like you have, which is awesome. Yeah. I'm glad that you're able to do that. Where did the HR manager reach out to you from?
LinkedIn. I would say, so I'm someone who's not really active on LinkedIn, so I won't post a lot of it. I won't post a lot of stuff, but I'm passively active. So, I like stuff, and, I'll either reach out to people a lot for a coffee chat or just to know what they really do. So I would say this LinkedIn really worked in my favor. And even after that HR person reached out, I was able to contact one of my colleague, and she was just have like a coffee chat and ask her that what do you do really for your job, because I don't quite understand what this whole consultant part mean. And she also has an MPH from McMaster's. So again, I was just able to ask her that what are some skills that you are applying that you took from grad school, and what is a learning curve, what are new things that I could expect, and how does the recruitment process look like. And she was more than happy to guide me through that process. And then again, I did successfully cross each part of the interview, and yeah, I got this position.
Okay, that's awesome. And I like that you highlight that, like, even though that you're not like actively posting a lot of things, you're still passively active in the sense that you're interacting with people and engaging and probably interacting a lot more in the chat with people and reach out for those conversations, which I think is something that even if you're not being like active, there are always ways that you can still be active and get seen on LinkedIn. And it seems like it's an awesome resource, and it has been an awesome resource for you. So that's awesome as well. So before I move on to the next question, I wanted to ask, so you graduated during the pandemic, and you seem to be very proactive